Hey everybody, it's Dr. Hofmann over at Temple Heights Animal Hospital. Just wanted to come on and talk about vaccines a little bit. We've been thinking about vaccines a lot lately, of course, in our own lives, and especially because it's back to school time. We're kind of getting back into a routine, sort of, as we know it today. And one thing that some people are getting caught up on now that they've had a little bit of the craziness of the past year and a half and things are slowing down is vaccines and routine care for their pets. And I just wanted to come on and tell you a few things that I hear that I feel like we need to talk about and dispel some myths and things like that. So stick with me for a couple of minutes. There's some really good gems in here that I think you're going to like. Feel free to discuss this with your own veterinarian if by chance you don't come to us, because everything is dependent on your own dog. And that is the first thing we want to talk about. One of the myths, I think, is that all dogs need or don't need the same vaccines. And that's just not true. And the same goes for cats. So if your cat is indoor only, living a totally different lifestyle from, say, one of my barn cats that goes out and hunts and it's in contact with all kinds of other animals and other things, they're going to need to be on a different vaccine schedule. My indoor cats are on a different vaccine schedule from my outdoor cats because of that. And in the same way, of course, we have dogs that barely ever touch the ground. They may not go out and do a lot. They're certainly not going hunting and camping, but those dogs maybe go to the groomer or they go to a doggy daycare 1 or 2 days a week. And so they're going to need some other vaccines that the other dog doesn't maybe, and vice versa. So that's the first thing, is there's no one size fits all when it comes to vaccines, whether it's for dogs or whether it's for cats. So definitely discuss your dog's lifestyle with your veterinarian. That's the first thing that we need to do. Now, speaking of little small dogs that never touch the ground, that's another thing that we will talk about sometimes with people who come in for vaccines for their pets. They will maybe want to do only half of a vaccine because their dog is very small. And what I tell them, without going into a super boring immunological discussion that I think is interesting, but nobody else does, and that's fine, is that no matter the size of the animal, their immune system, get ready, is the same size. Mind blown, right? Think about it. Your Chihuahua has an immune system that is exactly the same size as that of an Irish Wolfhound. Just like a baby has the same sized immune system as a 250-pound man. When we give vaccines, we don't distinguish between the age or the weight of a patient when we do vaccines for that reason. So if someone comes to me and they say, oh, my dog's very small, I just want to do half of that vaccine, that's going to be a no from me. And you may find some veterinarians who will do that for you, but the science just isn't there. And I would hate for an animal to not be protected against a disease because we were scared of something that isn't actually true. So again, talk that over with your vet and see what's right for you. Now, one thing that is true is smaller dogs can tend to have more vaccine reactions if we do more vaccines at the same time. So often, if a dog is under 10 kilograms or so 20 pounds, 15, 10-pound dog, something like that, your veterinarian may choose to alter the vaccine schedule and deliver those vaccines a little bit differently. So for me, if a dog is due for rabies, bordetella, and a distemper parvo, I may say, oh, they're going to get groomed, so they definitely need the rabies for that. We're going to do the rabies and the bordetella today, and then you're going to come back in 7 to 10 days, and then we'll do that distemper parvo. So that can be something where we're just not overloading their immune system with too many things at once, but the dosage remains the same, and that's really important. So speaking of the groomer, that is something where those groomers will typically want you to get a bordetella vaccine, and that's for quote unquote kennel cough, but that's something that we see in the environment everywhere. So it's caused by a few different agents, and even just being outside, being where another dog has been, can expose your dog. So I always encourage people at least once a year, if your dog ever is any place where other dogs are, to go ahead and get it, even though it's for quote unquote kennel cough and your dog doesn't ever board. So that's a little tidbit for you. But the groomer, back to them, bordetella, because there are other dogs in the grooming facility generally, and rabies, because if the dog were to bite the groomer, That's a whole thing. And the groomer wants to be protected. They also want your dog to be protected because then the quarantine is not as stringent. So the same thing goes for most counties or cities in the United States will have some kind of rabies requirement. So when we talk about what vaccines are needed, that's typically where we start because rabies is required by law in most places in the United States, whether it's the city administering it or the county or the state, they'll all have different sorts of guidelines. So that's important. And I will have some people ask me sometimes like, well, why though? We don't have rabies. And yes, congratulations, vaccines have worked. So according to the CDC, about 60 to 70 dogs and about 250 to 300 cats are tested every year and do come up positive for rabies. So their chances of getting rabies is low, but not zero yet. However, since the 70s and 80s, when we started having mandatory vaccine programs, domestic dogs are no longer considered a reservoir for rabies. So hooray. But we can't ever quite get rid of it in other places. So coyotes, skunks, foxes, raccoons, bats, all of those are going to be wildlife reservoirs for rabies. So it's important to get your animal protected. You never know. There's a bat in the house. When your dog or cat gets out and they're exposed to something, if they are bitten by an animal that we don't know their vaccine status, if they bite a person and they do not have a rabies vaccine, those situations are really fraught with a lot of problems and you end up having to quarantine your dog. Animal control generally gets involved. If you can produce a rabies vaccine certificate that says this is done, this is up to date, your life and your animal's life just got so much easier. So those are kind of the important things that I wanted to hit. If you have any more questions, drop them in the comments for sure. And be on the lookout for our other social pages. We're going to do a few more things about this on vaccine myths and updates on our Instagram and our Facebook and things like that. So any questions, let us know. Thanks.